And he says to me, give me 10 weeks. I promise I'll change your life. And I'm not kidding you. I feel like I'm in my 20s. My level of productivity at work, my cognitive, my physical, I mean, just everything. This guy is a genius.
What have you done to Dana to make him so enthusiastic and to, in his eyes, prolong his life?
How has your daily routine changed from this year to last year? Like, what's the difference in your daily routine?
The difference is that, I spend my mornings now on my health. Right. I do the superhuman protocol.
I'm a huge believer in the superhuman protocol. This is why I put a PEMF mat in my bed. I set it to go off before I wake up in the morning. It will alkalize all 32 trillion cells in the human body.
I take my health seriously.
If you're in an area with high 5G interference, you have to get a PEMF mat. You don't have a choice.
When it comes to the technologies that you think work really well for PEMF, what are some of your favorites for biohacking technologies?
So my favorite is the Pure Wave. I've looked at a lot of different PEMF technologies.
QRS and Pure Wave are the same mat.
That little yoga mat looking thing right there, that is a PEMF mat.
And when you use a PEMF mat, it has the same effect as grounding on the earth?
Is it better? I mean, if you lose you use a low Gauss PEMF mat. I like that one for because I measured the low Gauss current, and we actually did some dark field testing of our own, and we actually found significant improvements in blood viscosity and also in the clumping of red blood cells, and that's visible.
So one of the biggest things we can do is get one of these PEMF mats, slip it into your bed, set it to come off in the morning before you even wake up, and every morning that you wake up, you'll wake up in an alkaline state. I live in Miami part of the year, and when I put in my 1000 Biscayne Boulevard address, man, I'm like, radiation chamber, all this 5G. So I use PEMF to blow that frequency out of the body.
I read a lot of stuff online that, listen, I get it. People are going to be skeptical, and people were talking about that I'm getting scammed. You think I would get scammed? Do you think I would allow myself to be scammed? No. I've lost like 36 pounds. You see people on Instagram all the time that lose weight. People decide to lose weight, they lose weight. But there were a lot of different problems with me that were going on that I've been talking to doctors for 10 years. None of them could fix any of my problems. And many of you out there have the same thing. Sleep apnea. You can't sleep. You're snoring, you're choking, whatever it is in the middle of the night. What do? They give you a CPAP machine, which doesn't work, or you leave it on for a while and rip it off. I had problems with my legs, and I had problems with my trach. I had problems I didn't realize I had that doctors didn't even tell me. In 5 months, this guy completely changed my life. And this is for all the naysayers that are saying it's not true and it's all bullshit. Well, right here, everybody was saying, well, share your blood work with us. We just did my blood work yesterday, and here you go. He's going to give you the results of my last blood work test, which now has been, I'm in like 20 weeks, or 25, whatever. 5 months I'm in this.
Yep. For 5 months, we got the before and after blood work. You can't fake these numbers. It's not my opinion. This is just a fact pattern.
So after the 8-minute QRS therapy, there's many biological effects which can be proven, not just subjectively by you feeling better, but for me as a doctor, more important, all these biological effects can be proven objectively, most of the time by doing a blood test before QRS and after QRS.
So you're going to see in the CBC, when you start looking at blood work, you're going to see a measure called hematocrit. This is the measure of his blood viscosity, meaning how close was his blood to motor oil or how close is it to water. You're going to see that the hematocrit has come down, meaning his blood has actually gotten thinner.
So QRS is a 100% natural blood thinner, unlike all the other blood thinners in the market, such as anticoagulant drugs or antiplatelets or so-called NOACs. QRS does not interfere with blood platelets, it does not interfere with vitamin K, it does not block thrombin or factor 10A. QRS is the most safe blood thinner in the world.
You're also going to see one of the amazing things is the white blood cell profile start to improve. There's all these funny names for white blood cells: eosinophils, basophils, neutrophils, lymphocytes. But what you're going to see is these things line up in a perfect V-shaped pattern. This means that his immune system has actually strengthened. We've taken the same number of immune cells and we've oriented them properly, and now his immune system's like an iron horse.
QRS helps to improve the function of all your cells, including your immune cells, and thereby also of your, for example, your T cells transporting more antibodies, but also importantly circulation of your lymphatic system, which is super important in your immune system.
Then you'll look at the next section called Comp Metabolic Panel. This is where we start looking at organ function. You're going to see that his kidneys have not only increased their filtration rate, but the poison levels are coming down. Kidneys filter something called blood urea nitrogen and creatinine out of the bloodstream. When that comes down, you've got less poison in the blood.
QRS, the number one thing it does, it strongly improves blood circulation. And if your kidneys get more blood, now your kidneys are already more effective in removing all the waste. So you're going to see positive effects. This can all be proven. Normally, I ask all my kidney patients to first do a measurement of all their relevant kidney parameters, such as GFR, urea, and creatinine levels. Then use the QRS every day, not just one time, but use it every day for about a month. And you're going to see improvements in all these relevant parameters.
So then we get to some of the really fun things, like triglyceride. A lot of you might know that a triglyceride is just a fancy name for a fat. So your level of triglyceride is the level of fat in your blood. It should be 150. When we pulled Dana's blood in June, it was 764. We got a life-threatening alert call at 1 o'clock in the morning from LabCorp because that number was so high. When I met Dana, I told him I was surprised it wasn't painful to tie his own shoes, because when I saw that, I knew he was having something called claudication.
And it was painful to tie my own shoes. That's where he got me. He told me things about me that I didn't even tell anybody. So he knew just from looking at my blood. And he's telling you, they were at 764. I was on the verge of a stroke or a heart attack or something bad. In 5 months, he got those down to what?
143, from 764 to 143. Total cholesterol from 243 to 173. Here's the amazing thing. If you know anything about cholesterol, there's a really, really nasty one called VLDL, very low density lipoprotein, or very lethal cholesterol. This is like chewing gum floating around the bloodstream. It's really sticky. That fell from 133 to 26. You cannot make this up. Almost 80% lower than the day that we pulled it. So now he's actually not taking cholesterol medication anymore. He was doing these Repatha shots.
Oh yeah, by the way, I've been on blood pressure medicine, thyroid medicine, and cholesterol medicine for over 10 years, probably more like 15 years. Now, in 5 months, I'm literally on none of that medication. I'm not taking any medication now.
Importantly, the main reason why QRS is effective in improving your cholesterol levels is because QRS has this strong proven positive effect in reducing inflammation. So if there's too much inflammation in your body, it damages your blood vessels, it makes all these ruptures. Now cholesterol comes to put as a bandage on your inner lining of your blood vessels. So QRS, it treats the cause of the disease, that is reducing inflammation, and thereby there's less build-up of this LDL cholesterol.
Yeah, your blood pressure was 116/85 the last time the nurse took it.
And you're also going to see a reduction of your blood pressure.
Testosterone stayed right in the upper end of the range because we're doing TRT, hormone replacement therapy, not a huge deal there. Another couple things that are amazing, he'd never had his level of homocysteine checked. Homocysteine is one of the most inflammatory compounds in the human body. It's an amino acid. When it rises, it causes a lot of havoc in the body. It can make your throat swell in the back, can actually start your blood vessels can clamp down because it irritates the lining of the blood vessel. You got 63,000 miles of blood vessel in your body. When they get narrow, your pressure can go up. His homocysteine actually fell from in the mid-20s, 22, all the way down to 11.7. That means we cut that inflammatory marker in half.
It will always result in a reduction of inflammation.
Marker in half. How can you tell? Well, you can measure it in the blood, but you can also see it in his organ systems. His liver function has improved. All the inflammations come out of the liver, AST, ALT enzyme. The measure of liver poison, called alkaline phosphatase, has plummeted. So low kidney poison, low liver poison, lower cholesterol, lower triglycerides, lower sticky cholesterol. And now we get to the big one.
And this inflammation that he's talking about, those of you out there that have sleep apnea or snoring, that's part of, have you ever got, if they don't put you on a CPAP machine, I had a doctor in LA told me what we need to do is go in there and cut your tonsils out and then widen your throat. What? That's what they told me to do. And now it's all gone because it was inflammation inside my throat. You might have the same thing.
Yeah, so imagine you bring this inflammation down and now you're breathing better, possibly even not requiring a CPAP machine.
If you use the QRS, you're going to see immediate improvement in your breathing, really in a matter of minutes. Often breathing issues have to do with too much inflammation, and as I explained, QRS has always a strong positive effect in reducing your inflammation.
The big win was when we got to blood sugar. So there's a measure of blood sugar in our bodies, not your glucose, which measures your sugar at the time the blood lab is done, but there's something called hemoglobin A1C. For those of you that know what this is a 3-month average of the blood sugar. This tells you what your average blood sugar has been for the last 3 months. You can't game this number. If you ate a box of donuts before getting your blood work done, it wouldn't move this number. At 6.0, he was not only pre-diabetic, he was 0.4 of a point away from becoming diabetic. And at 0.4 of a point away from becoming diabetic, he's now at 5.3, which is perfectly normal blood sugar.
How about this? I had doctors doing my blood, every few months. They didn't even tell me that.
And the other thing is, not only are sugars really high, hemoglobin A1C, but something else was really high called insulin. So when your sugars rise, your insulin rises. As you become more insulin resistant, it takes more insulin to lower blood sugar. The thing about insulin that escapes most people is that the primary role of insulin is not to lower blood sugar. The primary role of insulin is to block other forms of energy use in the body. So his insulin was at 32.4. 12 points higher than the normal end of the range. It's now 3.4. He has 1/10 as much insulin in his bloodstream as he had when we started. And he's eating healthy, regular meals. And he gets the majority of his caloric intake from healthy fat.
If you want to reverse insulin resistance, there's only one thing you can do, and that is you must change your nutrition. Insulin resistance, it affects all biochemical processes in your body, and thereby it is responsible for so many symptoms, health symptoms in your body. QRS, if you use it as a complementary therapy, it can absolutely not cure insulin resistance, but it is going to help you with all the symptoms of insulin resistance. And this works via various mechanisms. In this sheet, I want to explain that insulin resistance is not only driven by nutrition, by carbohydrates, but it is also driven by poor sleep and by stress, for example. And QRS has a strong positive effect in you going to sleep longer and in reducing your stress.
And I'm not kidding you. I feel like I'm in my 20s. My level of productivity at work, my cognitive.
Proven biological effect of QRS is that it strongly improves your blood circulation and thereby your oxygenation. And your brain is the #1 most important organ of your body, which takes about 20% to 25% of your blood circulation. So it is the brain where you are going to see the first positive, important effects of using the QRS.
When you take these different debits, you have high blood pressure, you have diabetes or pre-diabetes, you have high triglycerides, high cholesterol, you have hypertension, you have hyperinsulin, high levels of insulin, and you put them all into the same body. This is what was very dangerous to him. Dana was standing on the edge of a very, very steep cliff.
There were a bunch of people online saying, oh, this is that. Why would I lie? What do I care? You know what I mean? And why would I ever be a part of a scam? I would never. Those of you that don't want to do this, don't do it. Nobody's asking you to do this. Nobody's trying to make you do this. Do whatever you want. Stick with your doctor and good luck to you. But I'm going to tell you this, and this is the reason I've been doing this, because I know where I was, and I thought, this is part of being 50. I'm 50, I'm over 50 now, and here we go. That's not true. This is a guy who came to me and said, you do what I tell you to do, and I promise you I'll make all this stuff go away. Sounds like bullshit, right? Far from it. So I did all this, and I'm laying all this out there for you, because I know there are some people out there that desperately need this type of help.